Hi, everyone. Good afternoon. I'm Shelley Zhuang, founder of 112 Capital. Today, I would like to talk to you about data-driven healthcare. So first, let me give you a quick introduction about 112 Capital. We're an early-stage fund based in the Bay Area, investing in founders who are solving the biggest problems facing our world with emerging technologies. And here are just some of the emerging technologies that we focus on. And generally speaking, we invest in three broad areas: enterprise software, mainly driven by AI and cybersecurity; smart hardware and autonomous systems; robotics; new space; and quantum technologies; and lastly, in data-driven healthcare, which is what I'll be spending most of my time on today. So we are most interested in the confluence of two trends that's currently transforming the healthcare industry. The first one is the availability of more data. As most of you know, sequencing a human genome used to cost $3 billion in the 90s, and now it's only a few $1,000s. And we continue to see improvement and innovation in the tool space that allows us faster and cheaper access to data across various types of omics data, including genome, transcriptome, proteome, you name it, right? All kinds of omics data are becoming more and more accessible. And we also think it's very interesting to combine this molecular data with other types of data, including socioeconomic, behavioral, demographic data to further contextualize a patient. So this is just the first trend is the availability of more data. The second trend we're monitoring very closely is rapid advances in artificial intelligence, which is kind of what this conference is about. And just some recent examples that we have come across include using things like graphical models to produce a diagnostic system from symptoms. Another example is using training restricted Boltzmann machines with adversarial loss to build a model that can forecast how a patient might progress along the disease that he's on. And then lastly, we saw some very interesting work recently that's using reinforcement learning to build a model that can generate the novel molecules that optimizes certain properties for therapeutic development. So I think we're at the firm, we're just constantly amazed by the amount of innovation that's pouring into healthcare coming from data and AI. So given these two trends, we have built a market landscape around data-driven healthcare companies, and we break it roughly into 5 areas. The first area is what we call computational health, and this is just what I talked about, which is applying the combination of data and AI towards various problems in healthcare, including diagnostics, therapeutics, treatment and care, and clinical workflows. So I'll give some examples from our portfolio in diagnostic and therapeutics later. But within treatment and care, you probably have heard of a company called Flatiron Health that was recently acquired that's using historical data to help doctors come up with better treatment decisions for patients today. And then the next area is what we call consumerization of healthcare. And again, that spans across diagnostics, care delivery, and even for traditional industries like insurance, you're also seeing various products that are more consumer friendly. A quick example in diagnostics, the idea here is basically entrepreneurs are working on various ways to take tests that used to have to be performed in a lab and be able to do that at point of care and eventually be able to do that at home. So that's what we call consumerization of healthcare. The third area is digital therapeutics, and this is a very interesting area, an approach that treats disorders without using drugs or without relying on surgeries. And this is very important in any condition that can be behaviorally mediated, including prediabetes, diabetes, heart diseases, musculoskeletal disorders, various types of psychological disorders. And I'll give an example from a portfolio in the digital therapeutic space later on. The fourth area is what we call enabling tools, and we break that into 2 sub-areas. The first one is omics, new omics tools, right, that allows us to get faster and cheaper access to various types of omics data. I think I mentioned this earlier. Example from our portfolio company is a company called Loop Genomics. They built a sample prep technology that allows one to prepare the DNA in a way such that you can now obtain long-read sequencing data from short-read sequencers, such as the Illumina sequencer. And then on the right-hand side is robotics and automation. And so as I think I mentioned earlier, outside of healthcare, we invest quite a bit in robotics on its own, including investments in cruise automation for cell self-driving, Kindred for warehouse fulfillment, Savioke for hotel delivery, and so on. So we're very excited to see robotics and automation also moving into healthcare and life sciences. I'll give an example on that as well from our portfolio later. The last and the fifth area is synthetic biology, which I think is an incredibly exciting space to keep an eye on. This is the idea of engineering and redesigning biological systems to make useful products, right? To engineer for useful purposes. And so this could be reprogramming microbes for high-value chemical production, or it could be engineering T cells for cellular therapies, right? All the CAR T therapies that you hear about in the news is an example of a synthetic biology. So this is just a quick overview of how we break down the data-driven healthcare space, and I'm happy to talk about any of them in more detail later. But next, I just want to give you a couple of examples from our portfolio companies to just give you a more concrete idea of what are entrepreneurs working on today in the data-driven healthcare space. The first example is Bay Labs in the computational diagnostic space. And simply put, right, the most immediate, obvious application of deep learning in the medical world is applying it to medical imaging data. So that's exactly what they're doing. They're applying deep learning to echocardiograms, which is ultrasound of the heart. And what they're doing is they can automatically interpret an echocardiogram, for example, calculating metrics like ejection fraction, which is an important metric to look at for heart health. And then in addition, they can also allow someone who's not a trained sonographer to be able to capture the echocardiogram in the first place. So think of the software as almost like a GPS guidance software that can tell you move left, move right in order to capture the right views to get your echocardiogram in the first place. So some of their software has recently received FDA 510K clearance a few months ago. The next example in our portfolio, also along the diagnostics space, is called uBiome. So they have built the first sequencing-based clinical test for microbiome, both for gut health and also the vaginal health. And we think this is an extremely exciting data set that they're collecting. And we are very excited to see the types of products they will build by leveraging this data set of the microbiome. And next, I'll highlight two computational therapeutics companies in our portfolio. The first one is called Aranza, and it's actually a very simple idea. Oftentimes today, a single disease is treated as a single disease, but as a lot of us know, disease is actually very heterogeneous. So what Aranza is doing is they have built a computational platform that can essentially characterize heterogeneity in a particular disease, and then from that, they predict or derive compounds that will be effective towards a specific subpopulation of that disease. And they're applying this towards cancer initially. Deep genomics is another great example where they've built a number of machine learning modules that can predict the impact of a genetic mutation on various biological processes, including splicing, right, which is how you go from pre-mRNA to mRNA, including protein binding. So once there's a mutation in the DNA, how would that impact how the protein bind to that DNA location? And then also on polyadenylation, a bunch of other processes. And through this engine, they're now applying it towards the development of oligonucleotide therapies for a number of different genetic diseases. Next, I kind of mentioned digital health. Hinge Health is an example of digital therapeutics, which is, I think, a very promising way of treating disorders that we mentioned earlier. So what Hinge Health does is they focus on musculoskeletal disorders, which is just a fancy term for shoulder, back, knee, neck pains, which a lot of us have. And it's usually one of the #1 cost centers for self-insured employers. So what Hinge Health does is they essentially digitize physical therapy pathways, and along with coaching and community, and build that into a digital app along with some simple wearables. So through their 12-week-long program, the employees can essentially reduce their level of pain and the desire to have surgery. And this ultimately saves the cost for self-insured employers. So again, we think this is a very promising, the digital therapeutic space is a very promising area where we can treat disorders and conditions without using drugs or surgeries. Next is a company called Synthase, which kind of falls underneath the enabling tools, robotic automations space that I talked about earlier. And so what Synthase does is by using their software, a lab scientist can design, execute, and analyze biological experiments in a high throughput automated fashion. And so their software essentially serves as a kind of a middleware layer that can talk to various equipment in their own languages in your lab, right? So you can now perform experiments using various conditions and be able to repeat them reliably in a much higher throughput fashion. And lastly, I want to talk about Ginkgo Bioworks, which is in the synthetic biology space. This is a company that started out making microbes that can produce certain high-value chemicals. Initially, they made rose fragrances and vanilla extract, ingredients that you today have to extract from plants, which tend to be unstable and expensive, but now you can use microbes to just make them very reliably in a high-throughput fashion. They recently also formed a joint venture with Bayer to engineer a microbe that can take nitrogen from the air and fix them into biologically available nitrogen that plants can use. So you no longer need to make ammonia in a chemical way to make fertilizers, which actually accounts for 3% of carbon emissions in the world today. And lastly, they also have a joint partnership with a therapeutic company called Synlogic to make a certain enzyme through the microbe as well for patients that cannot naturally produce such enzyme. So the patient would take that microbe as a probiotic, essentially. So again, we think the synthetic biology space is definitely something to keep an eye on. So I think in summary, basically, we as a firm are extremely excited and continue to be very excited about data-driven healthcare. And I think it's a great time for entrepreneurs who are working on kind of interdisciplinary ideas of how to address different problems in healthcare, leveraging data and leveraging AI. So here are just some topics that we continue to be very excited about: computational therapeutics, synthetic biology, food technology, understanding how our brains actually work. So we've been looking at a number of companies in the non-invasive neuroimaging space. And ultimately, the idea is that if we can better understand our brain, we can perhaps put that intelligence into machines as well. And then lastly, understanding the science of aging will definitely open up a lot of new, interesting opportunities. So that actually concludes my talk. I'm happy to answer any questions that you might have. Yeah. So we don't yet use machine learning, but we are adding data techniques to our investment process. But I would say within data-driven healthcare, because it tends to be a interdisciplinary company, we look for teams that are interdisciplinary. So ideally, the team should have, both expertise on the AI and data side, but also understand what are the problems they're trying to address, right? Versus just coming up with a novel, clever algorithm. So I think that would be the ideal team that we will want to back. Yeah, so in terms of on the compound side, I think Chinese medicine or other types of libraries can definitely be used as an input. We haven't had an investment in that space yet, but we're actually looking at some companies that's mining plants today, ingredients from plants, right, which could be overlapping with Chinese medicine as a potential way to either as just an additive to food or potentially as a therapeutic as well, but it's naturally derived. So I think that's a very, very good area to look at. Yeah. Mm-hmm.
Could you talk about the actual data that they use? Do they generate it? Do they get it from somewhere else? What are the challenges that young companies face?
Yeah, so I think it depends on the company. I mean, there is a wealth of public data that's available if you know where to look. For example, there's a lot of gene expression data that's available for each different type of tissue, and you can analyze that as a particular input to your engine. But our companies oftentimes generate data on their own as well. So, for example, Deep Genomics is generating data on how oligonucleotide will interact with the RNA transcripts. So that data does not exist elsewhere publicly. So that's something they would generate internally. And to that point, I think data is oftentimes, especially for deep learning algorithms, you need a lot of data, right? So we are also looking at a couple of companies that can essentially build a predictive model, but with much fewer data points. So that's another way to kind of get around the data issue.
I'm curious if you're doing anything in the sort of mental health realm.
Yeah, so actually, mental health is a really good area for digital therapeutics. We have not invested ourselves, but I think there's been a number of successful startups that's working on that. I think including Pear Therapeutics and a few others that we know of. Yeah. Yeah. Mhm.
There's a prospect for clinical information systems in
Uh-huh.
investing in super new cutting edge technologies that have promise for new markets, investing in clinical information systems and what they can do. For example, for patient care, healthcare in
Yeah, so I don't know exactly what you mean by clinical system, but an area that's interesting to us, for example, would include clinical decision support. So if you have a AI-assisted diagnosis system, right, that go from symptoms to diagnosis, that's definitely of interest. So definitely, I think leveraging data or AI towards better clinical systems for either doctors or for administrative workflow at an insurance company, even those are all interesting areas. Yeah. Any other questions? If not, my email is Shelley at 112capital.com. You can just email me afterwards if you think of anything else. Okay, thank you.